Can you describe the state of the medical industry today? I just want to have I want to set the comparative objective that you're about to crush, kill, destroy. Yeah,
It's the cycle time. I mean, there's some good cures, but,
of
you
course.
get one of those diagnosed, what, you know, 30% of us are taken out with cardiovascular disease, another 25% with cancer, day in, day out. Neurodegenerative disease takes you out if you last long enough. There's the pathogens, there's the other chronic diseases like diabetes and so forth. And the treatments don't change that fast. It's now 26 years and close to $3 billion for a new drug approval, capitalized cost. The shocking thing, for a medical device, a novel medical device, it's close to $700 million in 13 years capitalized cost.
To
To
get
do
to
it
go
from
from an idea to developing it and getting it approved by the FDA.
just for approval, let alone reimbursement and becoming standard of care, which
Yeah,
takes you out to about $1.5 billion. So say you do that for a single rare disease because it's faster, costs less because you don't need as many patients. You spent 1 billion. Let's say you save some money. You call it 700 million. Few thousand people have it. What do you charge per patient?
yeah. So
Got six zeros
a
in
few
it, doesn't
thousand
it?
people divided by the 700 million, or 700 million by the few
So if
thousand
you really
people.
improve things, like, it's a understatement to say the vast majority of humanity can't afford that cost. So what are we doing? Why are we funding this? The biggest funders of healthcare R&D, 9 out of every 10 healthcare dollars in the US comes from NGOs and GOs, and they're funding things that's like, maybe trickle down economics works eventually, but
The saddest thing, and I know you've said this, is what percentage of drugs that are prescribed for you actually work?
oh, oh, yeah, the number's quite low. I
Yeah, it's
don't
like
have the
20%. It's
for
like
me personally, they work. I check that because I
yeah,
take other drugs.
yeah,
But
but it's
but, like, literally in that case, I'm missing part of my brain. It's a pituitary gland. I molecularly replace at age and sex appropriate doses. But for most people, yeah, do they work or not, and do they cause harm? It's a thing, and
yeah,
for sure. And, like, it's 40 to $70,000 per patient in a clinical trial, and it takes years to get them through. For a bigger disease like mental disease or neurodegenerative disease, you gotta do 10,000, 100,000 patients. So the cost becomes and the time becomes prohibitive. So to we have to somehow change this if we want more innovation and to leverage the tools of our time. Yes, AI, but also Moore's law are two of those big exponentials. So there's others as well, which you can list for us because
I
like
list them all
how
the
do we
time.
use?
Yeah,
But clinical trials
yeah.
are they're exponentially slower and exponentially more expensive over time, as has been well graphed, and they call it Moore's law backwards, Ebrum's law. So that's the big problem that I think you have to change, which enables you to enable low cost, but also get more data. If
Mhm.
you can get more data than we've ever had before, you can it's less risky for a regulator to approve a new treatment or medical device or so forth. But it's also safer for a doctor and patient to make a decision for their health care. So why not just collect more data? We're really good at crunching data. We're going to learn even more through crunching the data with the AI tools than we have. But for that, it's very hard if you're making a new drug that's never physically existed before and putting it in somebody's body to get that kind of scale quickly because you got to go through some tests first.
So what Mary Lou is talking about is using physics and AI and chipsets to just not only diagnose but treat disease.
Right.
It is it is 60s. Um, it is dramatically dropping costs by not 10x. We're talking about potentially, hundreds and thousands of x reduction in cost.